My name is Dr. Ifeanyi Nsofor. I'm the CEO of Ifeanyi and the Director of Policy and Advocacy at Nigeria Health Watch. I'm a public health physician and I'm also a Senior New Voices Fellow at the Aspen Institute and a Senior Atlantic Fellow for Health Equity at George Washington University. And I'm a health journalist. Interestingly, when I think back to when I was in medical school at the Nnamdi Azikiwe University, School of Medicine, and eventually during my postgraduate at the Liverpool School of Tropical Medicine, health journalist was definitely not a title I thought I was going to have one day. But there's no doubt that being a health journalist, being a global health thought leader, and writing different opinion pieces on different aspects of health, I've come to realize how strategic it is to be a health journalist, because essentially, one is shaping opinions, shaping policies, leading to behavior change by people as they adopt, better health-seeking behaviors and better ways of improving health for themselves as well as for their communities. I've written almost about 90 opinion pieces. 17 of them are co-authored with my colleagues from different countries. And when I think about it, it's just amazing, because essentially my health journalism work really started in 2018 after I was selected as a New Voices Fellow at the Aspen Institute, being trained on the art of writing opinion pieces, public speaking, advocacy, radio, TV engagements. And when I look back, there's no doubt that the Aspen New Voices Fellowships is probably the most important single push for my career within the past 3 years. I've written for different outlets. I've been published, Project Syndicate, the Africa Report, NPR, Goats and Soda, All Africa, all sorts of platforms. I mean, anybody who wants to read up on the things I've written, I've curated on my personal websites, ifeanyinsofor.com/opinion pieces. But I also see it as a very huge responsibility to shape public discourse, to shape policies, to shape people's behaviors, because it's almost like a spiritual exercise as far as I'm concerned, because it's such a huge responsibility to undertake, but obviously also has its perks, its benefits. So, for instance, in 2020, I was selected as one of the top 100 most influential Africans by the New African magazine, and also selected as one of the top 100 coronavirus healthcare professionals globally by Analytica. And for me, when I look back to say which of my writings, that really I think has been most impactful, I think that's really very difficult to say, if I'm being honest. But I think that my current piece that I wrote for NPR on COVID-19 vaccine inequity, another different type of COVID-19 vaccine inequity regarding the Green Pass that was introduced by the EU, which bars people like myself that have been vaccinated, fully vaccinated with the Oxford AstraZeneca COVID-19 vaccine, simply because the brand that people like me in Africa, Latin America, as well as Asia have been vaccinated with is produced in India by the Serum Institute of India. So I wrote that piece for NPR, and it's been read more than 20,000 times. The last time I conversed with the editor. But also it has, led to, further interviews by the BBC, Focus on Africa, by the Associated Press, and even by ESPN. I mean, who, in my wildest dreams, I never thought I was going to be featured on ESPN. But here we go. Simply from my writing, putting my thoughts, my opinions, it has led to, such level of recognition. And I think also talking about impact, the piece that I wrote on the Ebola vaccine, as well as the one I wrote on the malaria vaccine, both published by Project Syndicate. Both of them collectively have been published, print copies more than 9 million times, in 18 languages in about 17, 18 countries. I mean, that is like saying that one is a bestseller in that particular topic that I wrote about. So I see, for me, my future, I think, is still going to be shaped a lot by the work I do in health journalism, because increasingly the world wants to hear from people like myself, experts from the global south, to help shape opinions about how things should be done in global health and other aspects of development. So I'm also a leading voice on decolonizing global health. I've written extensively on that. I've spoken about that, in different fora. Health journalism is something that I'll continue to do in different forms, through my writings, through my speaking engagements on TV, radio, as well as virtually, thanks to COVID-19. And when I talk to my junior colleagues, I tell them that there are two skills I think they should build. One is a skill on writing, and the second one, skill on public speaking, because I think these two skills would be beneficial to whatever sector you decide to work on, to work in any day going forward. So really, happy to share my thoughts, and yeah, thanks.